Now, also with this virus, we must stay alert because we're still learning. And what we thought we knew doesn't always turn out to be true, okay? This virus has been ahead of us every step of the way in this country. When we first started with this virus, we were told it was coming from China, right? Wuhan province, it came from China, and it's going to come from China now to the United States. Turns out it didn't come from China to the United States. It did in some parts of the country, but the East Coast, it turns out it came from Europe. I talked to everyone all day long. In the beginning of this, nobody ever said it's coming from Europe. And we had 2 million Europeans come to New York, New Jersey, the big airports, international airport, JFK, and no one knew it was coming from Europe because it had gone from China to Europe, and then it gets here from Europe. No one knew. When this started, once you have the virus, you have antibodies, and then you're immune from further infection. That was stated as a fact. Now it turns out maybe you're not immune, even if you had it. Maybe you have some immunity, but not total immunity, we're not sure. Okay. Then we were told children are not affected by COVID virus. Great. Sigh of relief. Less than 1% of New Yorkers who are hospitalized under 20 years old. Now we're finding out that may not be 100% accurate either, because now we're seeing cases that the Department of Health is investigating, and New York is in many ways the tip of the arrow here, looking at 102 cases where children who may have been infected with the COVID virus show symptoms of an inflammatory disease like the Kawasaki disease or toxic shock-like syndrome. We have lost 3 children in New York because of this. 5-year-old boy, 7-year-old boy, and an 18-year-old girl. And these cases are all across the state, predominantly where the population is. 60% of these children tested positive for the COVID virus. 40% tested positive for the antibodies of the COVID virus, okay? That means children either currently had the virus or could have had it several weeks ago and now have the antibodies saying that they had the virus and they recovered from the virus. 70% of the cases went into ICU, which means they're serious. When you go into intensive care, it means it's serious. 19% resulted in intubation, which means they're very serious. 43% of the cases are still hospitalized. On the age, when they say children, it's across the board. It can be under 1-year-old, it can be up to 20, 21-year-old. Majority between 5 years old and 14 years old. It affects children of all races, and it's not just in New York. The Department of Health sent an alert to 49 other states. Dr. Zucker has been leading this conversation nationwide. 14 other states are now investigating cases in their state for possible inflammatory disease for children related to COVID. 5 European countries are now looking at this. Because it happened after the fact and does not present as a normal COVID case, it may not have been initially diagnosed as a COVID case. COVID cases are normally respiratory. This is not predominantly respiratory. It's an inflammation of the blood vessels, which could affect the heart. So it's more of a cardiac case than a respiratory case, which is a new manifestation of the COVID virus. Department of Health is being very aggressive in doing the investigation and also talking to other states, countries about what they may have learned, partnering with Rockefeller University and the New York Genome Center to see if there's anything in the DNA of these cases. But parents have to be aware of this. The predominant signs: fever, abdominal pain, skin rash, other symptoms, change in skin color, difficulty feeding, trouble breathing, racing heart, lethargy, irritability, or confusion. So it's a wide array of symptoms, as you can see, which makes it even harder for a parent to know exactly what they're dealing with. If your child has been exposed to someone who had COVID, even if it was several weeks ago, that is a special alert in this situation. Department of Health has told the hospitals in the state to prioritize COVID testing for children who come in with any of these situations. And if you want more information, this is the health site to go to. Now, as a parent, I can tell you, this is a parent's worst nightmare, right? To have a child, we thought that children were not especially affected by the virus. To now find out that they might be, and it might be several weeks later, this is truly disturbing. So we raise it because it's something that parents should be aware of. We're still finding out more about it. We're working very aggressively. The more we know, the more we'll communicate. For now, everything we know is on that website, but if parents say, you know, should I be concerned? You should be aware. You should be aware. First job is to protect our children. My baby is 22, not really a baby anymore, she likes to tell me. She's theoretically, this is 21 and below, she's 22. Maybe I have nothing to worry about. I still worry because that's what you do as a parent. You worry. I tried to get her up to come with me today, Michaela, 22 years old. You think you have any power in life? Try to get a 22-year-old out of bed at 7:30 in the morning, and you will quickly come down to earth about any expectation of anything. But go to the website in the meantime.